So before I beginning, I have to confess that I'm not a quantum guy at all. But I'm going to convince you that why quantum computing, kind of the iconic meme of these days, and emerging and disruptive technology, I believe that they can re-innovate the biomedical research and advance precision healthcare. Take it easy, just relax. So as I confess, I'm not a quantum guy, so there is no complex equations and math involved here. Okay, I would like to start some numbers here. Not big, but some numbers should be larger the better, or even smaller the better. But look here, every 2 seconds, someone in this globe actually dies prematurely from non-communicable disease like cardiovascular accident or chronic respiratory disease. But the striking number is that every 3.15 seconds, someone dies of cancer globally. So every human being has a dual citizenship, kingdom of the well and the kingdom of the sick. And the name implies that the cancer, the emperor of all malady, it's an invincible dictator of the kingdom of the sick. So in order to fight against this formidable tasks and disease, there has been a numerous efforts, worldwide, nationwide, or intercontinental. But after 3 decades of war on cancer, as you look at here, the cardiovascular disease, 1950, the age-adjusted death rate is 600 out of 10,000 populations. But the number, look at this one, they stay Plato as a public enemy number 1. So why is that? Obviously, as a treating physician, I treat my patient with a variety of lines of treatment like chemotherapy, and the complete and clean surgery, and the targeted drugs, or even the most updated version of the immunotherapeutics. But the thing is that most patients with advanced cancer actually they succumb to death because they have a reoccurrence of disease or a disease spread to the distant organs. So human beings tend to understand first and then take steps to control the event. So cancer is basically a disease of gene. So accumulating body of evidence clearly indicates that cancer is a genetic disease. And our research advances and we identify what causes genetic changes that ultimately lead to the development of cancer. So viruses, smoking, UV radiation, and chemicals, they are avoidable. But the thing is, some cancers are hereditary, and even the cells divide, and the errors in DNA replication actually accumulated and eventually developed into the cancer. But you know that there is a kind of quantum tunneling effect in a spontaneous DNA mutations. That is the very nature of our world operated on. So these efforts actually culminated in the Human Genome Project almost 20 years ago. So we now identify every single letter of life, A, T, G, C, in their sequence in 30 billions. And following on this Human Genome Project, we use this gene sequencing technology to molecularly characterize the cancer. So this single typical nationwide collaborative effort in the United States, the Cancer Genome Atlas, identifies more than 30 cancer types, and the multiple levels of information was generated from the sequence alterations in DNA to the copy number at chromosome level, and the mRNA gene expression, and the methylation of DNA, and even protein. And this is also integrated with the clinical data. So what happens after this post-genome? So do we get any better? Unfortunately, this is a public publication by the US CDC. So look at here, this is age-adjusted and the bisex. Cancer death rate remain Plato, even though this kind of huge endeavor across the nations and across the globe. Why is that? Do we need more data? But I don't think so, because data is everywhere. So out of these international, nationwide, or global endeavors to characterize the cancer at very their low level, but if we look at the very typical one of TCGA, we already generated 2.5 petabytes of data out of 300 different tumor types. So to give you the perspectives on how big this number is, 1 petabyte is equivalent to the 212 regular, 212,000 regular DVDs. So it's about the computation. It's not about the data itself. But the computational power is actually far lag behind the data generations. So which one? Which computational power you prefer? So at this moment of time, I have to think of what are the most important advantages of quantum computing in terms of healthcare and the multi-omic data analysis. So obviously there are a couple of quantum advantages in computation. By the inherent nature of the quantum phenomena, like a superposition, entanglement, interference, we can process data faster, and this is much faster speed than the classical computer. And this is due to the inherent parallelism of quantum computation. So through this advantage, we can generate more accurate and precise results out of the same data sets. So how to harness these advantages? So every aspect of healthcare can be enhanced and progressed by utilizing quantum computing, from the molecular simulation of target proteins, or exploring the chemical space to identify novel drugs, and even the diagnosis assistance, the therapeutic planning of radiotherapy, and the pricing of diagnosis as well. But I'm going to focus on the term precision medicine, the topic of today. So now we are at the transitioning period from the one-size-fits-all medicine toward the precision medicine. In this progress, we have to pass through the stratified medicine. So the first step of the beginning of precision medicine should start with the disease subtyping using biomarkers. So then how quantum computing can accelerate the precision oncology? So obviously, the precision healthcare requires more granular classification of disease, even at individual level. That is individual personalized medicine. So the quantum capabilities, like how this computational sophistication can translate this formidable task to real-world oncology practice, it has to identify very subtle multi-omic patterns that is linked to cancer subtypes. How many patterns can you actually recognize? This is a real patient transcriptome data I have generated, and then by eyeballing, you can realize 2 or 3 subtypes. If we use the machine learning algorithm, that is the state-of-the-art, like AI, that identifies 3 subtypes. And biologically, they are the mesenchymal, and the proliferative, and the metabolic. So it's beautiful. So do you agree? There are 3 subtypes here. Is it enough to do the precision healthcare for our patients? What about this? If you have wide eyes on it, then I can see that these 2 are likely have a different pattern, even though they are classified as a metabolic here. The point is, each and every strip of a column is a real patient. It's not just a figure or cartoon. So the subtle patterns here represent individual patients. The problem is they have diametrically different clinical outcomes, even though they treated with the standardized surgery and the chemotherapy. So the patient A and B, they have same sex and the similar age groups, and the most clinically usable information that they classify patients into low and high risk group, like a stage 2 tumor size and anatomic extent of disease. And even there, this patient has a worse prognostic factor, but the outcome is diametrically different. So these patients actually succumb to death after the course of treatment, like a liver metastasis. But this patient actually survive. So what's the difference? So the AI actually identified these two patients are the same category of patients. So we treat those patients with the same treatment protocol, but the result is like this. So in order to realize precision healthcare, it requires precise and reliable pattern recognition. So it's all about clustering and classification. So that reminds you of some kind of the techie thing. Yes, that's what AI does. They do clustering and classification. So the question is how to identify statistically significant and biologically meaningful and clinically relevant patterns from complex data structure. Again, this is a kind of a cancer genome data. This is multiomics, and by nature it's a multimodal, like a DNA. That means nucleotide in chemistry. Some is amino acid-based peptide and protein, and some is a kind of a small chemical compound like metabolites. And this is also multidimensional, and they are inherently non-linear and have a lot of collinearities between the variables. So quantum advantage, we can utilize them in analyzing cancer omics data analysis. We do believe that quantum computing can efficiently deal with the high-dimensional data analysis, and it can model the complex interactions of multi-omics data, and even it integrates with the molecular information to the clinical data, so that based on this essential clinical information, we can make a decision, right decision for the right patients in the right time. So again, the inherent nature of the quantum phenomena, the superposition and entanglement interference, can efficiently allow us to explore the data structure and speed up the optimization compared with the classical ones. So as Richard mentioned a couple of things about the quantum algorithm that is usable in clinical healthcare. So probably most of you realize that the quantum kernel method or quantum supported vector machine or quantum neural network, they can recognize very subtle patterns in nonlinear high-dimensional data space. So this is a busy slide where I summarize the what kind of quantum algorithms can be utilized in clinical setting and how medical research can be assisted by the quantum algorithms. And again, there are a lot of the quantum neural network and the quantum supported vector machine. All of these things are related to the classification of disease. So this is the first step toward the precision medicine implementation. So this is from the Cambridge University. So quantum computing use cases, there was a proof of concept. So notwithstanding the genomics and clinical research and treatment intervention, the diagnostic sector, it clustered similar individuals based on their multi-omics distances. And actually, they give a more practical and the precise clinical data classification. And based on this, they can assess the disease severity and predict the disease risk. So again, this is a precision medicine, and as I said, disease subtyping is critical. So how granularly we can classify the patient even at the individual level, that is the road toward the personalization of treatment. This is my own research result. That was almost 10, 20 years ago from now on. But I'm proud that we actually transform the laboratory discovery into the clinical setting. And now this clinical classification algorithm is available on a daily practice basis, even though this is a classic, it's not a quantum. But you can see that even the classical optimization with more, careful and precise, done by precise manner, then how can they help our patients? Actually, after this adopting the optimization strategy by more sophisticated classification of patients, you can see here we achieved a 15% increase in the real-world patient survival. That was not possible before this classification scheme. So I do believe that harnessing the pinnacle of human intelligence can revolutionize the precision analysis of our clinical and multi-omics data. And I do believe that this is a true enabling technology for advancing precision medicine. So to summarize, I do believe that computation is a modern-day stethoscope. So it is interesting. So my young junior doctors, they never wear the stethoscope around their neck, even though myself. So I don't have any stethoscope nowadays. My gown is empty. But the thing is, using the computational power, we can help our patients far better than using stethoscope. This is a technology reshaped the world of precision medicine. So again, the quantum computing based on utilizing and harnessing the quantum mechanics is a new computing paradigm. It represents and processes the information in a radically different way from the classical binary computing. So obviously, it revolutionized the computational capabilities that is required to implement precision medicine. So every aspect of healthcare can be enhanced by using quantum computing. So for the sake of time, I'm not covering or touching on some of these, but obviously this technology can revolutionize molecular modeling for in silico identification of small molecules or even the proteins, and the genomic, multi-omic data I already mentioned. And the quantum imaging can also revolutionize how to see or visualize even the small cancers even before they cause a symptom. And even we believe that at molecular level, we can detect cancer using the quantum imaging. And the quantum sensor can monitor the tumor metabolic activity in real time so that we can follow a patient with a given treatment. But admittedly, there are challenges lie ahead. Noisy, the coherence time, scalability, hardware limitations, and interoperability with the classical computer. But the thing is that we have to more care about the quantum algorithm, as Richard mentioned, so that there are lacking of algorithms that utilize the more mathematical things to fully extract the benefit from the quantum hardware. You already know this, so one of the most inspiring physicists mentioned this. So these remarks actually paved the road toward the quantum computing, and we physically build a quantum computation. And we believe that it is the right device the human being have to simulate the natural quantum system. So what do you think of this? The DNA, it's a language of life. And I think the grammar system of DNA is a quantum. So I'd like to conclude my talk saying that quantum computing is not merely a tool for disruptive technology and high-performance computation. Rather, I think it's a new paradigm of thinking. We human races now think differently from the past, and actually that leads us to the terra nova, where we can explore the fundamental nature of life phenomena. So this kind of new understanding of the true nature of life and disease obviously redefines the precision healthcare. With that, I would like to thank and stop here. Thank you.